Hello viewers, myself Dr. Vindoo and I am Senior Homeopathic Physician at Nation Care Homeo Clinic, HSR, Bangalore. What would happen if you would suddenly wake up with a bulge or a tumor in your body? It's not that every tumor that grows on your body is cancerous. You would first think about cancerous and you would get panic. But we also have something called as lipomas. Lipomas are nothing but a fatty accumulation underneath your skin. So what happens in lipoma? What exactly is this lipoma which can panic you thinking it could be a cancerous tumor? So usually what happens is our body had a system called as fat metabolism. So underneath our skin, the fat cells has to uniformly get distributed and form a very thin layer of fat which helps us for insulating. But usually what happens in certain people when they carry a genetic background of lipoma or their eating habits or lifestyle is so haphazard that a mutated gene triggers an accumulation of all the fatty cells underneath the skin and in between the muscle and the skin at one particular area. So this lipoma is nothing but it's a non-cancerous benign fatty globules accumulation which can, when you press it with your finger, it can be little hard. The size can vary from smaller to bigger. Ideally, lipoma is something that you don't have to worry about. There is no risk that you're carrying. But what happens is sometimes due to the cosmetic reason, the lipoma can be little irritating. Because obviously, if the disease is within you, you usually don't have to speak about it to anyone. But when you have something which is visible to the eyes, when people can recognize that you're going through some problem, obviously you tend to feel bad in answering them and you want to get it treated. So many people, what they do is they go for cauterization or the surgical remove of the lipoma. We need to understand if there is one lipoma that is grown on your body, definitely the same tendency can also bring more number of lipomas and also the size of the existing lipoma can also increase. So what we have to do is the tendency of the fatty accumulation has to be treated where homeopathy is certainly going to help you out. So getting operated or the removal of the existing lipoma is not the permanent solution. The tendency of the formation of the accumulation or the formation of a lumpy thing underneath your skin has to be removed. So constitutional treatment methodology. See, a person can have this lipoma anywhere in the body, but there might not be any symptoms other than feeling some lumpy sensation. Some people can have, in addition to that, if they have a secondary inflammation or secondary infection, they can also have associated pain or the redness, etc. can be seen. But it is in particular to the areas where the lipoma is growing. If it is growing in certain sensitive areas or it is compressing the nerve or the lipoma has more blood vessels, then certainly some people can have a pain associated whenever they have the movement of that particular area. Along with that, the habits, like are you a person who take a lot of alcohol intake or underneath do you have any other ailments due to which this lipoma would have got triggered, or non-veg eaters or high protein intakes or lifestyle. So there are different factors based on which the individualistic homeopathic treatment will not only reduce the size of the existing lipoma, but the tendency also gets treated on permanent basis.